Formulas that regulate the qi. Yueju 1. Escape restraint pill. All ingredients. Use equal portions or equal amounts of each ingredient of Kangzhu, Chuansheng, Shangfu, Jizi, and Shenchu. To prepare as a decoction, use 6 to 12 grams of each ingredient. Promotes the movement of qi and releases constraint. Indications are focal distension, stifling sensation in the chest, stifling sensation in the abdomen, pain in the hypochondria, belching, vomiting, acid reflux, slight cough with copious sputum, lack of appetite, indigestion. Some cautions and contraindications. This formula is contraindicated in qi stagnation due to deficiency. This formula can be used in the following Western medical illnesses: digestive disorders including peptic ulcers, IBS, chronic gastritis, biliary tract infections, gallstones, chronic hepatitis. Also, neuropsychiatric disorders like intercostal neuralgia, migraine, globus hystericus or plumpit qi, epilepsy, cerebral thrombosis, some types of depression. This has also been used to treat dysmenorrhea, hypocalcemia, coronary artery disease, and pelvic inflammatory disease. Some modifications are: if liver fire, remove Kangzhu and add Bai Xiao and Mudan Pi. If more blood stasis, add Taoren and Honghua. If more phlegm, add Ji Bansha and Ji Tiannanxing. If more dampness, add Hopu and Fuling. If more food stagnation, add Shanja and Maya. If also there's cold in the middle burner, remove Jizi and add Wujuyu and Ganjang. For more distension, add Qingpi and Chenpi and Jishi and Binglang. If mainly qi stagnation, add Yujin, Mushang, and Wuyao. Bansha Hoputang, Pinellia and Magnolia bark decoction. All ingredients: Ji Bansha 9 to 12 grams, Hopu 9 grams, Fuling 12 grams, Shengjiang 15 grams, Zisuya 6 grams. Promotes the movement of qi, dissipates clumps, directs rebellious qi downward, and transforms phlegm. Indications are: a feeling of something stuck in the throat, plumpit qi, cannot be swallowed and not coughed up. Also a stifling sensation in the chest. Tongue is moist or greasy and white. Pulse is wiry and slow or wiry or slippery. There can be coughing and possible vomiting. This formula can be used for the following Western medical illnesses. So disorders that are marked by a feeling of something stuck in the throat. Globus hystericus, which means plumpit qi. Or irritable bowel syndrome, hysteria, psychoses, epilepsy, depression, perimenopausal syndrome, Parkinson's disease. Other disorders of the throat: goiter, edema of the vocal cord, hyperthyroidism, cervical spine syndrome, tonsillitis. Other digestive disorders: esophageal strictures, spasms, gastritis, indigestions, and respiratory disorders such as bronchitis and emphysema, possibly Meniere's disease, morning sickness, and vertebrobacillar insufficiency. Some modifications are: for severe stagnation of qi, add Chai Hu, Yujin, and Sheng Fu, and Qing Pi. In case of vomiting, add Sha Ren, Ding Sheng, Baidu Ku. In case of abdominal distension, add Sha Ren and Mu Sheng. For pain and swelling in the throat, add Xuan Shen and Jiageng. In case of chest pain, add Gualo and Xiabai. For hypochondriac pain, add Xuan Lianzi and Yanhu So. Suzi Jiang Qi Tang, perilla fruit decoction for directing qi downward. All ingredients: Zi Su Zi, 9 to 12 grams. Jibansha, 6 to 9 grams. Chen Pi, 6 to 9 grams. Dangwei, 6 to 9 grams. Gansao, 3 to 4.5 grams. Hopu, 3 to 6 grams. Chenhu, 6 to 9 grams. Rugui, 1.5 to 3 grams. Directs rebellious qi downward, stops wheezing, stops the cough, warms and transforms phlegm cold. The indications are coughing and wheezing with watery and copious sputum and a stifling sensation in the chest and diaphragm. Other indications are shortness of breath with labored inhalation and smooth exhalation, possible pain and weakness of the lower back and legs, edema of the extremities, possible fatigue, excess above and deficiency below, and the tongue is white coating with either slippery or greasy coating. Some cautions and contraindications. Contraindicated for treating lung and kidney deficiency in the absence of an external contracted pathogen. Contraindicated in wheezing and a productive cough due to heat in the lungs. This formula can be used for these Western medical illnesses: emphysema, bronchial asthma, chronic bronchitis, cardiac asthma, and also morning sickness. Some modifications are: for a simultaneous cold, add Ma Huang and Qing Ren. In case of more sputum and coughing, add Chen Pi. For more qi deficiency, add Dang Shen and Wu Wei Zi. And for urinary difficulties, add Che Qian Zi. For more difficult in inhalation but without lower back pain, remove Rugui and add Chen Sheng. Ju Pi Juru Tongue, tangerine peel and bamboo shavings decoction. All ingredients: Chen Pi, 9 to 12 grams. Juru, 9 to 12 grams. Renshen, 3 grams. Shengjiang, 6 to 9 grams. Gansao, 3 to 6 grams. Dacao, 5 pieces. Directs rebellious qi downwards and stops hiccup, augments the qi and clears heat. Indications are hiccups, nausea, dry heaves, retching. Tongue may be normal or red. The pulse may be deficient and rapid. Some cautions and contraindications. Contraindicated in excess heat or cold from deficiency. This formula can be used for the following Western medical illnesses: gastritis, post-surgical hiccups, incomplete pyloric obstruction, and morning sickness. Some modifications are in cases of yin deficiency with thirst and a red tongue with scanty dry coating, add mai mendong, ji hu, and lu gun. In cases of excess heat with a yellow tongue coating, add huang lian. In cases of no qi deficiency, remove ren shen. In cases of phlegm, add ji ban sha and fu ling.